I was actually paralyzed for some time, but I snapped out of it after half a day. But upon snapping out of it, I felt that my whole legs, both legs, from the groin down, both legs had no feeling at all. So the nerves were all dead.
So where did you seek help? And what was the prognosis and the initial diagnosis given to you?
Prognosis was that my whole spine, from thoracic down to the lumbar, there was something like 5 to 6 compressions. So my nerves were all compressed and the fluid wasn't flowing. So I lost all sense of coordination. I lost stability. I couldn't stand. I couldn't walk. And the solution presented to me was to go for surgery. And in that surgery, when I asked about the chances of recovery, I was told it was 10 to 20%. So what the surgeon did was, what the orthopedics told me was to go for physiotherapy. So I went for 3 months physiotherapy. After 3 months, the therapist told me I only improved very marginally. And she said, in the first 3 months, normally your progress should be at the fastest. But because my progress was so slow, she didn't give me very much hope. She told me, by the end of the year, you may still be using a walker. So based on that, I told myself, I have to find an alternative.
Can you tell us what was your very first encounter with Pain Clinic? Please describe and tell us more about that.
When I first came to Pain Clinic, the first thing that happened was I did a trial session and I found that it actually helped me. And from there, 5 months ago till now, I've moved from being in a wheelchair to now walking without walking in.
This 5 months of journey, can you also tell us exactly what was being done, the whole journey of this 5 months, what was done in Pain Clinic?
I think what sets Pain Clinic apart from hospital physio is that if you go to a hospital physio, you have one therapist handling 2 to 3 patients at one time. It's normally a 1 to 1.5 hour session, and his or her attention is split between 2 to 3 patients. Monitoring was then difficult. It was difficult to cater individually to each person, to each patient. So progress was naturally slow then. Pain Clinic was different in the sense that when I first came, there were 3 people helping me at one time. It gave me a sense of assurance that the care that was given or will be given is going to be tailored to my condition. After every therapy session, I was re-energized and I could do my exercises, I could walk. So it's a whole package compared to a normal physio in hospital whereby you go there, it's just exercises. Whether or not you can do it, you just do it. And at the end of it, I need a wheelchair to bring me home. So it doesn't make sense. So that's the difference between Pain Clinic and a normal physio in the hospital. The thing about Pain Clinic is that there is a dedicated therapist for me. For every patient, there's a dedicated therapist. So you have one therapist following you through your journey, and you have the principal therapist who is the owner supervising. So you have the best of both worlds. Rehabilitation is very important because it actually works your muscles, every set of your muscles in your body. It's always tailored to your legs. It's not just my legs, even though it's the only problem. Even my hands are being worked with medicine ball, with dumbbells. So it works the whole body. I can stand without problems. I can walk at least 100 meters without any walking aid. And right now I'm focusing on strengthening my legs and having more core stability And I think in 1 month's time, I should be starting to run. I think so, hopefully. And I would recommend pain clinic to anybody who has got my same problem or a deviation. I booked